Now we have the different people, right, are having the different structure of the bones in the human body, and depending on that, right, there are the different range of the motions are there of the each joint of the person, right. Just example, the way your collarbone and your scapula is placed and the size of your head of the humerus plays a significant role in the movement of your arm, right? So mostly there will be the similar movement, but still when we do the yogic practices, there will be a lot of differences are there into the movement when we do asana. Many people are not able to perform certain asana is just because their bones are not allowing them to do it. I will say the movement is not further possible because of the compression of the bones is not the restriction which is coming from the soft tissues, I will say from the muscles or from the ligaments or some other soft structure, but it is coming the hardcore compression of the bones, right? So we should assess that, right? How different bones are moving in different direction and where the point of compression. So this point is the point of compression is happening because of the restricted movement. If I will show you, if I raise the arm up straight, so this humerus bone is coming in the point of compression with the acromion process of the scapula. So this is the scapula and this is the acromion process. So it is coming in the compression with each other, and now it brings the restricted movement there. So there is no further movement is possible there. The similar way when I'm taking the arm up back, so after reaching to the point, again it is causing the restriction, right? So like that, we have to see the range of the motion of the each joint in each individual, and also we have to see the deformity from the birth. So few people are having the deformity of the certain bones, and because of that the range of the motion is also affected. And sometime somebody went through the accident and went through the surgery, and the way the bones are joined again is different, and because of that it is causing, I will say, a restricted or a change in the range of the motion of a particular joint. So we have to see the individual cases, right? And depending on that, we have to teach the asana to the student, right? So every asana is not made for everybody, right? So we should do the asanas with the modification according to the individual limits which is arising because of the difference in the skeleton system, right? So if I will say in short, if the restrictions are coming because of the compression of the bones, then you will feel like the sharp pinching pain on the joint somewhere, right? And if that is not because of that, then there will be a more of the lengthening pain which is happening in the muscles, right? So, and the same way, like suppose if I am bringing the hip forward, so now the hip cannot come forward is because of the compression of the pelvis to the femur bone, right? But if I will straighten the leg and now lift the leg up, right, more higher there, now the restriction which will come is because of the hamstring muscles. If the hamstring of the muscle of a person are tight, so the person is not able to, I will say, flex the hip joint, the femur bone, right? So we have to identify if certain restrictions are coming. So these restrictions are coming because of the bones. Now there is no more space into bones, and it is actually good, the compression of the two bones. It makes the bone stronger, the density of the bone increases, but the overcompression can cause the injury, right? We should be careful about when we are doing the yoga practices, right? We should not bend the joint so much in the wrong direction, which can cause the tear in the ligament or the soft tissue injury in the joints. Practice consciously, mindfully, know yourself, right? Namaste.